doing now is we're going to be breaking down our room so that we can sterilize it and reset it up for our next patient. One of the main things that it's really important to remember is that you always have your PPEs on, your personal protection equipment, which are your eye glasses, your mask, and your gloves. Whenever you're breaking down a room, you want to make sure that you're very careful on handling any of your instruments due to the fact that we do have our sharp instruments and we do not want to get poked. We're going to start by removing all of our plastics and our throwaway material. We're going to take our chair cover and use it as a bag to gather up all of our plastic instruments. Now that we've disposed of all of our throwaway items, we're going to gather up all of our instruments and so that we can take them back to the sterilizing room. Now that we've removed all of our throwaway items, we're going to start gathering up our instruments that need to be sterilized. We're going to start with our hand pieces. Before we remove them though, we have to purge them. We're going to remove them from the unit. You place oil in the two areas that need to be oiled. And then we have to run them for 30 seconds. This is called purging. This is making sure that oil gets all the way through our hand pieces before they go through the sterilizer. And you do the same thing with the slow speed. Now that we've gathered up all of our instruments, we're going to take them back to the sterilizing room. Now we've removed all of our contaminated instruments and we're going to sterilize the room. Before we start wiping it down though, we want to take our Birex and we want to spray everything, all areas. Now we'll be taking our cavity wipes and we're going to start breaking down the room. With your cavity wipes, you want to make sure you wipe all areas. Including handles or units where our items are sitting. Our air and water storage sits, our high speed, and our slow speed. We're going to come over here now and do our suction tips and the assistance side. Use as many cavity wipes as need to be used to sterilize your room. now our room has been wiped down. We're going to reset it back up. Before we reset our room up though, we do need to remove our gloves and wash our hands. Replastic our room and get it ready for our next patient. We're going to replastic all of our handles. And we're going to place our new chair cover on our chair. This room is now sterilized and ready for the next patient. We've sterilized our room and now we need to break down our syringe. What we're going to do is that we're going to use our Sharps container here to help us break down our syringe. The most common thing as far as contamination for an assistant is needle stick. So we want to be very cautious. When you're removing your syringe, you're going to place your tip of the head of your needle in your Sharps container. You're going to just hold it and unscrew the needle off. Let it drop into your Sharps container. Okay. Then you're going to pull back on the plunger to remove your anesthetic. You're going to place that then in your Sharps container. Now you have taken the caution of not getting any punctures by any needle sticks, and you've done it safely.